Hi everyone. Tonight's Insta Live is all about the low FODMAP diet. It's a diet that has been shown to be effective in 3 out of 4 people with IBS, irritable bowel syndrome, but it can be a really tricky diet to follow, which is one of the reasons why we decided to make healthy frozen ready meals based on the low FODMAP diet to help people follow this diet. But people have so many questions about this diet, and so tonight we thought we'd unpack these questions with registered dietitian Anna Pettit over at the Gut Health Clinic, and she is going to be joining us to answer most questions about the diet. And Anna has a wealth of gastro experience or gut health experience over at the Gut Health Clinic. Hi Anna, how are you?
Hi Sasha. Hi everyone. Thanks for inviting me. I'm good.
Thanks. Sorry, go ahead.
I'm good. Thank you. How are you?
Brilliant. Excellent. I was just starting to give a bit of an intro to yourself. Could you give me a little bit of your background?
Sure. My name is Anna Pettit. I'm a dietitian who specializes in gastrointestinal conditions at the Gut Health Clinic. I've been a dietitian for over 12 years. I've got a background in many chronic conditions, but gut health always interested me. So I decided to really dedicate my career to learning about this area and also helping people along their way with their functional gut conditions. But I also see quite a huge chunk of inflammatory bowel disease, which is a different type of organic condition, so different to IBS. So I'm very, very excited to be here. I'm very passionate about the low FODMAP diet and educating people about this area of therapies in IBS. So thank you for inviting me.
Oh, I'm really excited about this chat. So this Insta Live is number 2 of 4. We are doing 4 Insta Lives together with the Gut Health Clinic over the month of April because it's IBS Awareness Month. And we wanted to really provide free access to expert dietetic advice because that was some of the feedback that we've certainly had across at Field Doctor, that people aren't able to access dietitians, don't know how to access them, haven't seen a dietitian, despite the fact that they've got IBS or have tried to follow the low FODMAP diet. So really excited that we're able to have these events. We're archiving all of these sessions so that you can access the information afterwards. But tonight we are specifically going to be focusing on the low FODMAP diet and the elimination stage of the diet. There is a reintroduction stage, and we're going to be covering that in next week's Insta Live, next Thursday, which will be all about reintroduction. So come back to us if you want to know a little bit more about that. So I've got loads and loads of questions that came in about the low FODMAP diet. So I think let's shoot. Let's start with the first one, Anna. Tell me, what is the low FODMAP diet? I think that's probably a really good place to start.
Well, let's start with the basics. So FODMAPs is an acronym that stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which in a sense means that it's they're short chain carbohydrates or sugars that are poorly absorbed in the small intestine. That's the area of our gut where the digestion takes place and the absorption of many nutrients. So they because they're small and they're sugars, they are drawing water by osmosis from the bowel walls in the small intestine, creating quite a lot of stretch, and then obviously going into kind of the undigested undigested state to the large intestine. That's where a lot of our bacteria lives, and bacteria loves it and uses it as food. So it ferments it to produce a lot of energy, to thrive. And with that, a lot of gas is created, and it also stretches the large intestine. So why is it an issue in IBS? We know that the FODMAPs are malabsorbed in all people, some more than others, and I'll touch on that a bit later. But in IBS, we know that the hallmark of IBS is actually the hypersensitivity of the gut. So when that stretch happens, when that kind of excess water accumulates and it stretches the small intestine, or the stretch of the bowel, happens when the fermentation takes place in the large intestine, it creates a lot of discomfort for somebody with IBS because of that hypersensitivity, so it's called visceral hypersensitivity. And I think here, I just want to mention in terms of the diet, it's a process. So it's not just the elimination phase that we're going to cover today. It's a 3-stage diet. So it's a therapeutic diet, evidence-based diet in IV, but it's used as a second line diet usually. So after certain lifestyle and dietary changes, such as looking at your eating habits or looking at your lifestyle, have failed, or perhaps in conjunction with some of the changes, in your lifestyle. So I think this diet has been shown to help 3 out of 4 people with IBS, which is great. And it has been shown to reduce the bloating, the wind, also the pain and discomfort associated with that excess kind of fermentation that takes place, and also improve the quality of life. So it's a brilliant diet to have under your belt. So that's in a nutshell.
Yeah, and I just want to reiterate that it is a second line dietary approach. As you've mentioned, there's quite a few things that you can still, or that you should be looking at changing with your diet or tweaking with your diet before you embark on the low FODMAP diet journey, simply because you just need to get those basics right, and those basics will apply to the low FODMAP diet as well. So you started to talk a little bit about sort of the mechanism of the low FODMAP diet, or FODMAPs, and their impact on IBS. And I think it's really interesting, having seen a little bit of the literature, that they have this osmotic effect and they draw all the fluid into, or a lot more fluid into the gut. And I've seen some, a study where they published that there was an increase tenfold of the movement of fluid. So I can imagine that really, puts a lot of strain on the gut. But also there is fermentation, isn't there, as a result, that's happening in the colon. So I don't know if you want to just quickly touch on that before we unpack a little bit more about the diet.
Sure. I think, as I mentioned, because they're carbohydrates or sugars of different lengths, so obviously, some of them smaller than others. So as an example, fructose, we know that some of the FODMAPs are actually malabsorbed in everyone, irrespective of whether you have IBS or not. So some of the FODMAPs, although, are very individual. So, for example, with fructose and lactose, it's more of the individual response that we see. And fructose and lactose are actually the smallest sugars out of all the FODMAPs. They are single for fructose and double kind of joint sugars for lactose. That's why they're called mono and disaccharides. And when you when you've got IBS and you consume quite a lot of fructose in your diet in excess of glucose, because when we have glucose, not an excess fructose, but quite a normal amount of glucose, I would say, is quite well absorbed. But when you get to that point where you tip, you may be eating too many fruits, or maybe you're having a lot of honey or other kind of syrups that are high in fructose, that's where we see that malabsorption takes place. And we do see classical symptoms of diarrhea, a lot of discomfort that associated with the distended small bowel, bloating, a lot of pain and discomfort that associated with that. With lactose is also individual, because lactose needs lactase enzyme that lives in the brush border of the small intestine to break it down. And when one particular person with IBS lacks that enzyme, or perhaps he's had a gut infection and it's a kind of secondary lactose intolerance, that doesn't happen. And in itself, it can cause quite a lot of discomfort. And we often see, that being quite quickly, so nausea, kind of diarrhea associated with lactose intolerance. With regards to other FODMAPs, just to quickly touch on, so you've got oligosaccharides, so those are, with a subset of fructans that are found in wheat and also in some vegetables like onions, garlic, leeks, and also the galacto-oligosaccharides, so beans and pulses. So those are actually malabsorbed in all people, whether you have IBS or not. And, thinking about the days when you eat too many beans, as an example, or, we just lack the enzyme that digests it. So the bacteria that it lives in the large intestine does it for us. So it digests it, and through that it creates quite a lot of fermentation, and hence, quite a lot of discomfort as a result for those with IBS.
So talk me through the basics of the diet and how it works. I've got IBS. I've been told to go on the low FODMAP diet. What does it look like?
I'm hoping that you were told to go on low FODMAP diet and see a dietitian, because we often see people on a low FODMAP diet that's been on it for years. I mean, we know that diet is intended to be a short term, and the reason being is that evidence suggests, actually, as studies suggest, that when you follow it for longer than required, it does cause negative impact on your gut microbes. So, you kind of counterproductive here. So that's why it's really important to consider it as being a process, a stage, stage kind of 1, 2, 3 of the diet, and really get some guidance, I guess. So I think, when you embark on it by yourself, it can be quite overwhelming. I mean, I do see quite a lot of clients that have been on it before, and maybe they haven't done it very well or properly, they kind of didn't reach that symptom relief, so they're kind of a bit more reluctant to do it. But I think once you get to that stage where you need to follow it, definitely somebody like a FODMAP trained dietitian or health professional with their expertise in dietary management needs to guide that particular person. And as you mentioned before, in terms of the guidelines, so we've got nice guidelines in IBS management, which came out quite a while ago, and in 2017 they were corrected to say that the FODMAP diet should be really supervised, because you get much more out of it, and you get much more symptom relief, you are more compliant, you're more accountable, and you actually improve your quality of life overall. So stage 1 actually entails, it's very short term. Thinking about it, it shouldn't really be followed for longer than 8 weeks. 2 to 6 weeks, that's something that is recommended. And, in some people you see improvement very earlier on. In some, you need a little bit longer. That's why there is kind of like a gap between the 2 and the 6 weeks. So, but
how long would you generally expect someone to be on the elimination stage of the diet to start seeing a benefit?
I would say a couple of weeks to see, to start seeing some benefits generally. But I would say it depends. So when we assess a person with IBS in clinic, and we think that low FODMAP diet is appropriate, because there are conditions sometimes that coexist with IBS that may not, allow that person to follow that diet efficiently, or, it's not recommended. So when you get that person in the clinic and you think that that's appropriate, you kind of chat about the symptoms. And I think that's where the dietitian comes in, depending on the severity of the symptoms, that low FODMAP diet can be adjusted. So we often kind of see, people for like light approach, FODMAP light approach, where you only focus on some of the FODMAPs. In others, the symptoms are so severe and they haven't been able to identify any triggers. So you focus on kind of, all the FODMAPs. So you need to cut those out. And let me just put this straight here. It's not a no FODMAP diet. So you still do have some. So it's a low FODMAP diet. It's about reduction, really. So it's not about cutting out, complete food groups. You still have some. And there are some apps, like Monash app, to help you, to guide you through that diet, through the process. And they use traffic light system, which is really a brilliant way of navigating through the diet if you're doing it on your own, or you've been, seen by a dietitian and you've kind of gone home and you want to go through the process again. And it should be a short term, really. You kind of eliminate and then you aim to reintroduce. And I guess we're covering reintroduction at the next talk. So yeah.
Yeah, so you know, effectively it's this process where you have the first stage, as you said, up to 8 weeks, where you're eliminating FODMAPs from your diet. Then there's a gentle process of reintroducing to understand your triggers. And then I think there's a longer term pictures once you've
Yeah.
identified what your triggers are, to have this sort of modified diet or individualized diet to yourself, having identified those triggers. Also, just want to reiterate, you mentioned the Monash University Low FODMAP app, a fantastic, really reliable tool. They're always analyzing FODMAP content in different foods, and I think they have the most up-to-date lists if you are looking for some guidance for that 8 week period, alongside, of course, your dietitian. So, what type of foods generally are you looking to remove from your diet? You've mentioned beans and lactose-containing foods such as dairy, fructose being an issue. You know, I guess, big question, is the low FODMAP diet the same as a gluten-free diet? What are you removing from your diet?
Well, as I said, with the acronym FODMAPs, you've got certain carbohydrates that tend to be generally malabsorbed, such as fructans in wheat. So we're kind of aiming to reduce the amount of wheat in the diet, but you know, it's not gluten-free. Usually, I mean, what I get in clinic is I've taken the gluten out. I felt so much better. But we do know that there is a subset of people who may be reacting to gluten as a result of being undiagnosed with celiac disease, which is an autoimmune reaction to gluten, or non-celiac gluten sensitivity. But the general kind of population of IBS patients tend to have an issue with fructans rather than gluten in wheat. So when you cut gluten out, you kind of cut wheat out. So that's why you feel so much better in terms of, you know, fermentation and all of those symptoms associated with that. So it's, as I said, it's a short-term process. So it's very much like cut it out and then aim to introduce once your symptoms are under control. So you are looking at reducing wheat-based products, you're looking at reducing onion and garlic, well, cutting them out for the duration of the elimination diet. And you're looking at fructose-containing foods. Obviously, those are certain fruits or honey, you know, fructose, corn syrups and mangoes. So there is a list that comes with it. And when we see people in clinic, we've got a specific booklet that is actually designed by the King's College University London. And it also gets updated quite regularly with, you know, with the kind of research in FODMAPs. So you've got a book to follow, you've got a dietitian who's guiding you. I mean, what can go wrong is brilliant. And in terms of lactose, like you mentioned, you know, lactose-free products are easily accessible. So it's the lactose that you're cutting out. It's not dairy as such. So it's, you know, some of the cheeses are naturally lactose-free, like harder cheeses like cheddar and parmesan. So they're actually included on the low FODMAP diet. So, and I feel very passionate about the balance of the diet. So when you are actually going on the diet, you need to think about how balanced your diet is. And when you're seeing a dietitian, you can actually discuss these things. You know, there are certain conditions that require, for example, more calcium in the diet. And when you're doing it by yourself, I think what I generally find with my clients that come from the, you know, from GP already kind of been given the advice is that they cut dairy out because they think dairy is an issue. And some of them actually need quite a lot of calcium in the diet. So you're cutting out quite a large chunk of calcium. So we try to go over, you know, a few things and how to reintroduce certain, you know, low FODMAP diets that are rich in calcium, and also alternatives. We discuss alternatives as well. And I think that's really important, is not to think of it as just the elimination. You actually need to replace it with the lower FODMAP foods. So that's an important thing to remember.
Yeah, and to start focusing on what you can eat rather than what you can't eat. And I think that's the issue that I've had when I've seen people in clinic in the past, is that they have taken so much out of their diet that they're actually eating so little. And that we know that diversity of foods is really important, not just for gut health, but also for a diversity of nutrition and nutritional balance. And, you know, there are some nutrients that are at risk. You touched on dairy, because people tend to remove all of dairy rather than just the high lactose containing foods. But, you know, calcium's an issue. What other nutrients are at risk when you're following this diet? You know, what else should people be watching out for?
I mean, overall, when you think about the balance, I think when you're cutting foods like wheat or whole grains, you know, and certain vegetables and fruit, the fiber tends to be, you know, tends to go down. So the intake of fiber can be an issue. So as a dietitian, we kind of work with the patient or with clients, kind of looking at the overall fiber intake and trying to accommodate for those kind of weeks where they may lack fiber, especially if that person is not opening their bowels regularly, and you kind of want to make sure that they are meeting their fiber requirements. And it's very important, obviously, to still include some of the prebiotic fiber, because you want you know, to maintain the balance of the good microbes in your large intestine, because I mean, we know that it negatively impacts the actual elimination stage, can negatively impact on the composition. So you don't want to make matters worse, because as we know, sometimes in IBS, you've got a bit of issues with the composition of the gut microbiome. You know, it's the microbes, you know, microbial dysbiosis, if you like. So you don't want to make matters worse with the low FODMAP diet.
So any other top tips that you would, that you're happy to share for anyone that's thinking about embarking on their low FODMAP diet journey?
Yes, so I think in order for it to be successful, I mean, we know that it works in 3 out of 4 people. We know that sometimes it doesn't work, okay? You need to plan, and I think careful planning, you know, kind of familiarizing yourself with the diet, with the booklet if you've been given one. I mean, there is a wealth of information on the internet, but unfortunately not all of it is actually evidence-based, and some of the lists are very restrictive. So I would always recommend seeing a dietitian for this journey, because it just makes so much sense. You know, you know, you hit, you know, so many targets with it, because you are accountable. You know, you're more compliant, you're imbalanced of other nutrients that may be lacking. So, and also I've lost my trail of thought. So, in terms of nutrients, fiber is very important. Yes, that's what I was talking about. So yes, so meeting your fiber requirements, looking at ways to, you know, if you are cutting out wheat-based products, which are a great source of fiber and prebiotic fiber, what are you replacing it with? Thinking about kind of planning in advance. So it could be some of the wheat-free, gluten-free grains, you know, such as quinoa, an example, buckwheat. You know, those are great ones to include, because they're very fibrous. They contain quite a range of nutrients. You know, we've touched on calcium. Also, for some, if you're struggling with your weight and you've lost weight unintentionally, or you're generally quite a slim person, we know that generally when you do follow a low FODMAP diet, energy overall, which is calories, tend to decline. So you may lose weight, and it may be not something that you are looking for in this diet. So I think working with a dietitian, you could get foods in that are a little bit more, you know, nutritious, high in energy, to maintain someone's weight.
Yeah, I mean, I think one of my top tips would be for anyone who's about to embark on this journey is to kind of go in with reasonable expectation levels. We know from the stats that 3 out of 4 people with IBS benefit when following the diet. But that means there's 1 out of 4 people that this diet doesn't work for. And even that can be really, really useful knowledge to have, because then you know that diet isn't the trigger. And I've had patients in the past that suddenly realized stress was the issue, or their lifestyle, but they needed to sort of do that diet journey first to understand it. Any other top tips that you would share, Anna?
Well, I think obviously eating out can be quite a challenge, isn't it? I think, you know, planning your social activities with the low FODMAP diet. I often hear, it's a bit restrictive, you can't really go out, but it's all about kind of preparation. It's all about finding out, maybe just calling the restaurant before, looking at the menu beforehand, downloading the menu, looking at low FODMAP options, looking at something that is easily modifiable. Perhaps, you can ask to leave the garlic out or to leave the onion out if it's a salad, as an example, it's freshly made. Or, perhaps if there's nothing there, you can go to another restaurant that it has more choice. And, for somebody who's got busy lives or looking for convenience meals, something like the meals that you are creating would be really useful to have us stash in the fridge, because they're low in FODMAPs. They're not going to cause symptoms, and they can be also kind of enjoyed as part of the low FODMAP diet.
Yeah, and I've had people in the past who've gone out and eaten a meal and had some onion in it, and it was okay. Yes, they had symptoms, but actually it reinforced that onion seemed to be a trigger for them. So, in a way, it was a really useful exercise. So they're on the elimination diet for 8 weeks, and then they're going into the reintroduction. What if the diet doesn't work for them in those 8 weeks? Do they still go through reintroduction phase, or how do you manage that process?
I mean, it depends. It depends whether through the diet elimination you're able to identify. It's possible to identify still triggers without being, without reintroduction. But we know that IBS is such a multifactorial condition, so it's affected hugely by stress, anxiety, and we know the psychological therapies in IBS are just as powerful as the low FODMAP diet. So we've got research that shows that the gut directed hypnotherapy works equally as good as the low FODMAP diet. So that's an amazing discovery. So I think for those people who find that diet is not, the food is not a trigger, I think just focusing on the psychological aspect and perhaps managing stress, managing anxiety, doing meditation, looking into doing gut directed hypnotherapy, whether that's with the gut hypnotherapist or by using something like a Nerva app, which was designed specifically for people with IBS and with gut hypnotherapy in mind. So I think, given the psychological aspect is so huge in IBS, there are other therapies that can be tried. And also, physical activity. It may be that, there's certain fibers that you need to tweak in the diet, and that would help. So I think that's why working with a health professional who's got a good base knowledge, base of knowledge in IBS and the low FODMAP diet is really helpful.
Yeah, and I've had clients in the past that have thought they were doing the low FODMAP diet, but actually they were following a list that they perhaps got from their GP that wasn't updated or wasn't correct. So I think also top tip is make sure you're following the diet properly. If you're going to do it and you're going to do it for those 8 weeks, to do it properly with the right guidance. And if it isn't working, it might be because you're not doing it properly. Go see a dietitian. Make sure that you've got that app, or that you're following that King's Low FODMAP diet booklet, because these are reliable sources of information.
Yeah, that's right. I agree with you. I think when you assessing your symptoms, you need to look at, obviously it's great when you start the diet to know your symptoms in the beginning, and then at the end, have they improved? And the way to do that is often keeping the food and symptom diary, or using something like a Monash app.
Great tip. Yeah.
So it's all about severity, and I guess just remembering that some of the symptoms are normal, and some bloating and wind is okay. Everyone would experience it after eating certain foods. And we do know that IBS actually fluctuates. So sometimes the symptoms are mild, and even how you respond to certain foods can be different from day to day. So I think that's like a ring bell, to say is something else involved here, and try to explore that avenue.
Yeah, and it's also possible that in this process you might also identify that it isn't IBS that you have. You know, I know in the past I've discovered that, you know, the low FODMAP diet wasn't working, and someone, the client actually found out that they had something called bile acid diarrhea, which is, you know,
Yeah.
not managed with the low FODMAP diet. There's a completely different management strategy for that. So if people want to go away and find out some more information about this diet, you mentioned that there are lots of, you know, a lot of information out there online, which isn't. So where can people go for the right information?
So of course they can go to our blog. We write a lot about the low FODMAP diet, also the gut health doctors education hub. There are some articles there. You can go to Monash website. They've got loads of information on the low FODMAP diet. And I think, you know, going and seeing a dietitian, we can potentially tailor the diet to you, and we can adjust it to the severity of your symptoms and make it your own. So you don't need to do it, you know, on your own. You've got somebody to guide you and really support you through your journey.
And you've written a blog post about the low FODMAP diet, which I know we're going to be sharing afterwards. So for anyone who wants to do a little bit more reading, we'll make sure that we've got that blog post to share as well. So that's fantastic. Thank you. I have so enjoyed this chat. Thanks again, Anna, for sharing your wealth of knowledge on this topic. I feel like there's loads more questions. We'll have to do another one of these another time. But I think to say to everybody, you know, make sure that you do see a dietitian. That would be my last top tip. Any last top tip you want to share, Anna?
Well, I think just like I would agree with you. I think if you've got somebody knowledgeable who can guide you through this, it's just an amazing weight off your shoulder. So it's just, you know, it's amazing. And I think because, as you said, not everyone has access to dietitian. I think just trying to get one can be such a nightmare, isn't it? So it's just speaking to your GP and seeing whether they can refer you. You know, that's a good start.
Super. Well, thanks so much, everyone, for joining us. Please don't forget that we're going to be doing number 3 of 4 Insta Lives next Thursday, where we'll be talking about the reintroduction phase of the low FODMAP diet. And thanks, Anna. Thanks so much for this chat. I really enjoyed it.
Inviting me. Thanks, Sasha. And thanks, everyone, for joining.
Thanks, everyone, and happy Easter.
Happy Easter. Bye.
Bye.